link for celebration of the US Day, and one of our very senior and great experience holder, the chairperson of our APNA organization, Dr. Shekhar Annabolterji is very much with us, and we have heard him so many times, and he has graced our platform with grace. His not only his presence, but also his all the modalities regarding the terms and conditions, laws, and also say punishment, or we can say the levies regarding the practitioners of Ayurveda in the terms of some other words. So he will also throw light over the scope of Ayurvedic or Ayush practice there in USA. So Professor Pawan Sharma is now completely ready for the start of the third webinar. That is, we are celebrating on the
thank you very
special
much,
day
sir.
of
We would
you.
like to
Thank you, sir. Thank you.
welcome you all in our 819th webinar. Thank you, Dr. Shekhar, for joining us with short notice. So nice of you. Thank you. I hope Dr. Vandana Varanwalji will also join us. I'm ringing the phone, but she is, I hope, in temple. Mayaji has joined. I don't know if Vandanaji has joined with any other name, but I would like to welcome Dr. Shekhar Annam Botla, who is my dearest friend and the Ayurveda flagship in USA from last 3 decades. So welcome, Dr. Shekhar. Now stage is yours. Please unmute yourself. You are mute. Please unmute yourself.
Okay. Can you hear me? Good. So, sorry. Okay. Welcome you all, for all the dignitaries and Pawanji, who is conducting tirelessly all the webinars internationally, nationally, doing globally various activities he is doing. And today we are celebrating the 4th July Independence Day of America, United States of America. And of course, in India, we have an August 15th is an Independence Day. In India, we celebrate. And July 4th is a celebration of Independence Day. So in the Independence Day, independence from what? From the one country to other country, they capture the countries to one country to other country. They came out of the freedom, getting a freedom. Freedom for living. Freedom for living is a very important factor here. Freedom for speech, freedom to thinking, freedom to thought processes, freedom to live, not do harm, no philosophy. So our philosophy is that do no harm. So with these 3 words, and we philosophically, we look into that Ayurveda, how Ayurveda is imparting into the worldwide like that. Our principles of in India, whether in India or in USA or Canada or any other, Japan or any other countries, our principle is that do no harm. Sometimes certain medications and some drugs and herbs which can be creating an untoward side effects are there. We have to be aware about the side effects of the individual products and everything. Then we can alarm them and explain them. Like for example, in the Western medicine, every medicine having side effects, majority of the side effects. Even still people are practicing worldwide. It's not banned medicine. Western medicine is not a banned medicine. It is a worldwide, people are popularly practicing everywhere, but the informed consensus are given to them. For example, Haritaki can create a diarrhea, or Triphala can create this type of problems, or Ashwagandha can create this type of problems. We need to have focus on Ayurvedic herbal formulations. What are the side effects which are there, noticeable like that, and observation like that. That how we know that observation, because in the ancient textbooks, they clearly mention that there is no side effect, there is no side effect, there is no side effect. But actually, there are side effects are there. If you take a Gunja, Karavira, Hingula, all the medications are having a side effects are there. So what we needed to do, we need to clearly mention and not to alarm the public like that. We have to explain that what are the side effects of each and every product from the, for example, excessive taking of coriander, excessive taking of carrot juice, excessive taking of any food items. Classically, we look into the food, the formulations can be divided into the various levels. First, pharmacopoeia has to be rewritten like properly like that. While the consumable items, which is day to day we are consuming, like from the mung dal to rice and quinoa and vegetables and everything like that. Then coming back to simple herbal formulations, simple herbs like the amalaki, ashwagandha, tulasi, and all the herbs. Then we need to classify them combination of the herbal formulations. And fourth category comes under this herbo-mineral combinations and some specific rasaushadhas formulations, all the and panchakarma therapies, what are the side effects, and all these things explained to the properly. Then we'll have a clear picture for the audience and the patients and the clients who are students aware about that, how to use. Misuse cannot happen in Ayurveda. So what is happening in the worldwide? People are misusing, and left and right people are prescribing the medications. Like for example, Pawan Sharma ji here, Dr. Pawan Sharma ji is the expert in the field of Rasha Shastra, alchemy, how the preparation of the medications has to be prepared, and the pharmacy and alchemy. So we need to clearly understand that what are the side effects of each and every product, and medications are there clearly written, and it is available in publicly, how many patients we have observed, how much data is there, and everything. A lot of people focusing on that, oh, this is good for all the diseases. Okay, from the Vata Rakta and it is Amavata and all the various conditions, we write up like that, but we need to know clearly, this is the freedom, creating a freedom for the people, freedom to speech, freedom to understand, freedom to do these things. Not only independence, getting independence. Independence what? We are working. Every day we are working, but at the same time, we have to make sure that our Ayurvedic line of the products and everything, like homeopathy, Unani medicines, and allopathy medicines, and naturopathy, even the yoga asana postures. Some of the asanas, recently, a pregnant lady asked me that, Dr. Shekhar, what are the contraindications of certain types of yoga asanas in pregnancy? What time we can do it? Clear-cut documentation, white paper documentation is required for everything. That way we can have references properly. Thank you one and all for joining with me. And I really appreciate there are other speakers are there with us. They would like to speak also on the Independence Day.
Today, you are the only speaker today.
Good.
You are representing the whole America. Yeah. For India.
Thank you. I appreciate all of you for taking care of time and taking the opportunity. This is the big manpower is required. A lot of commitment is required. And Agnihotri ji here, and also Pawan ji is here. They are all anchoring this webinars continuously. 819 webinars we have conducted like that. And it is going on continuously in the tireless way. It is available all the time. Information is available on the YouTube and Facebook Live, and everything is available. But what is the thing is, our goal is that conducting the webinars one thing, and
sir, you please inform something of your Apna organization performing activities there in America, in Pennsylvania, especially, so that we will be highlighted, and those who are interested to meet you, to go to America, will be benefited. Thank you, sir.
Thank you. This is a very interesting thing that we have established called Global Ayurveda Academy. Global Ayurveda Academy. This is the academy people together, and what we are asking, requesting the well-qualified Ayurvedic doctors and practitioners, clinicians, researchers, as well as integrative medical doctors and Vastu and Jyotisha experts also can contribute for training programs. For that, we are creating none of the government, in the government of India or any other country, has not established some guidelines. Some basic guidelines are there. World Health Organization has done a benchmark training in Ayurveda, and AYUSH Ministry has followed similar guidelines of the AYUSH Ministry in 2006. Updated things are happening there now. what is our goal is that Ayurveda in the Western countries is different practices that are like a polarity therapy, marma therapy, and doula. Doula is the midwifery, between the midwifery and nurses. The doula is that like an dhatri in Ayurveda. Dhatri, considered as a dhatri, is a very, very important factor. In India also, we need to create a dhatri certification program. That means women or men who are interested to join as a midwifery and nursing practice like that. Ayurvedic Dhatri program is also created. Then doula program. In that doula program, what we do, we have a variety of people who are undergo aromatherapy and basics of Ayurveda, doshas, dhatus, malas, agni, ama, and conditions like that. And at the same time, yoga postures and psychological comforting and comforting the woman as like an own sister or mother. Sometimes, a lot of times, what happens, there are a lot of single mothers are here in this country. So a single mothers means husbands are left, they don't have a support system is there. This doula acts like in a wonderful way of creating that when to do it, where the red flag areas are coming, what is the things are there, and when to refer to the midwifery or going to the OBGYN, obstetrician, gynecologist who can recommend them, or a hospital, high risk pregnancies and all the different conditions. They should know about these things. They are not handling the cases, but the thing is they are working. And a lot of diseases are also connected to the polarity therapy. Polarity therapy is we are north and east poles are there, we have, and south and east poles are there. Our body is like Western medicine, what we Western Vastu Shastra is also Vastu Purusha is mentioned. There are eight directions are there. In the 8 directions, our body reflects differently. A person able to sleep in the east side is able to sleep very well and sound sleep and everything. Sleep apnea issues and those issues, dreams and issues are there that reduces. Where the people who are putting the head towards the northern side, north head, that can have, and they have a disturbance in the sleep. And in Ayurveda clearly nidrayatam balam pumsham. So the strength is coming from the nidra, sleep, proper sleep. Proper sleep is a lot of people who are having insomnia issues and a lot of health issues are coming up like that. We have to rectify those things are polarity therapy. So of course, everybody knows about marma therapies. Marma therapy has to be fully fledged form of training program is required. So instead of looking for the Western aspect like that, I'm looking into the Western aspect of modern diagnostic tools and everything. Yes, they are required. But at the same time, we are not becoming a westernized doctors like that. What we needed to do, our strengths, we have to showcase our strengths, polarity therapy, marma therapy, doula analysis, the aromatherapy, various Pushpa Ayurveda. Pushpa Ayurveda is not developed anything properly. Pushpa Ayurveda is also very, very important. Of course, now veterinary Ayurveda is Pashu Ayurveda is clearly explained like that. Animal husbandry, there is a separate knowledge. And Vastu Shastra has to be incorporated. And at the same time, Jyotish Shastra is also basic understanding of the Ayurvedic graduates. Then basic of the Jyotish Shastra, where the importance is there. And there are Ayurvedic graduates who are clueless. Medical astrology, because planets are having influence on our physiology and emotions, and a lot of psychological conditions also, disturbance can come through the planetary influences. So some chronic diseases, cancers and obstinate skin diseases and some certain diseases where Jyotisha expert to be incorporated into the Ayurvedic colleges. Ayurvedic colleges has to have one Homa Kunda and Yajna Kunda, and as well as with the Jyotisha expert should be there. Then, like we are recommending the patients that, for example, if a person comes with sputum and sputum analysis, we send it to them to the lab and pathology lab. Same thing with urine analysis, sperm analysis, and blood analysis. Same thing. Our systems has to be developed like that. We have to. I highly recommend Ayush ministries to incorporate one Jyotisha expert, our team of Jyotisha expert to be in the Ayurvedic college as the faculty. Like we have an Ayurveda and Sanskrit teachers are there. and botanists are there, and researchers are there, medical doctors are there, and various factors are there. Jyotisha expert, Vastu expert also is there, and lot of times what happens, Vastu content like that, people can be healed properly like that. People, the bed should be where direction, which direction is there. Some Vastu Shanti can be done in the hospitals where they can incorporate a Vastu Shastra, Vastu, and then you will see the faster results, how the results are coming in the direction. I evidence in my practice also. I incorporate some of the Vastu principles as well as Jyotisha principles. We are launching through the APNA and Global Ayurveda Academy medical astrology. Medical astrology.
Sir, a few lines over the scope of Panchakarma practice there in
Right now, I have a patient right now. That's the reason I could not spend time with much time.
And
right
I found that which portion you left. So it is
Yeah.
the highlighted portion, that is Panchakarma.
Yeah.
How much US government allowing this Panchakarma practitioners?
Practice you can incorporate. It's not a government allowing or not allowing like that. As I told you that we are practicing Panchakarma. Like for example, today patient we have given Virechana therapy, and morning as soon as I wake up and morning I got a message from that way, and Dr. Shekhar, I'm not feeling good and dizzy, and can you come? Immediately I brush my teeth, even cup of tea also I have not drank, and immediately I have to go there and see the client and console them, explain them and everything. And once you give some sort of consolement and everything, then hot water bags given and everything, and some ginger and nausea sensation is there. Small, we explained everything, what is happens there and everything, and examine the pulse, blood pressure levels and everything, and how the consoling them that now they established like that, and we have given a kanji.
This is what the patient expects from the doctor.
Exactly.
This is you did. This is great consolation and the survival of our Panchakarma itself, because
Exactly.
he understood that the doctor is committed.
Patient and client is very important. How well this is the thing, and you have to take care responsibility and work on that, and develop them, and consoling them and helping them and giving the proper supplements and everything. Even I have to analyze the person's client thing like that. We don't give the Virechana therapy immediately. We give them for a few days, observe them whether they have a sattva is a avara sattva, majjama sattva, uttama sattva. That means mild, moderate and severe strength is there, mental strength is there. So that she will fall into the group of a medium sattva. She is not a strong lady. That later we have to make sure that we are giving the doses also according to that. Medicine is given yukti. This is the thing. Ayurveda is logically mentioned that yukti is very important, and some people can give stronger doses, some people can milder doses. Sometimes murdu virechana dravyasa, Krura Costa and Tikshna Virechana Vyas we have to give, and again strength will be taken care into the consideration.
Great, sir, great. I think you are our proud person.
Yeah,
you are our proud person of India in America. So really, you are always keeping up and hoisting the Indian flag also in terms of Ayurveda. Thank you so much. You for sparing your so valuable time, that too in odd hours. Thank you so much, sir. Over to point, sir. Yes, please.
Thank you. It's a very honor to be with this group of people, and definitely all of you people who are listening to this video and everything, YouTube link, please join and contact Dr. Pawan Sharma ji, who is tirelessly working, and of course he is not charging 1 penny to join this group like that. Please join with them and communicate with them your talents, expertise, and share with them. And this team is really good, and we have to contribute. We have to contribute some level of contribution always there. And Pawanji is always very wonderful to have this type of activities are doing worldwide. Not only that, and also I request all of you, please join the adjunct faculty members of the various programs. We are developing these programs, and 21 varieties of courses we are establishing worldwide. So these courses are there, and just now we started also world top 100 Ayurvedic doctors. World top 100 Ayurvedic doctors. We are creating a separate entity there, and we are recognizing the top 100 Ayurvedic doctors in the world, not only one country. We are going to recognizing the 100 because they need to have a vigorous information is required, experience is required, detailed database is required. In that we have a committee is there. Committee will review all the application forms and who are scrutinized properly and everything. Then we will list them properly on the website, on our website, Apna website. World top 100 Ayurveda doctors. 100 Ayurveda doctors. Okay. Thank you, one and all. Namaste to all of you. Go to the website called apna.org or studyayurveda.com, studyayurveda.com. There you can see all the information and posted there. And even my personal website is called ojas, ojas.us, ojas.us. And I am very thankful to all of you. And I am recently visited this Manasarovar Global University, where we have created
yes,
for you with
yes.
it's a wonderful way of connecting and a platform we're creating. Our goal is that to create more and more graduates to come, and the facility, Manasarovar Global University facility is so wonderful, very unique, and all the colleges are together cozy. That's called in Western way, we can say the cozy. Closeness is there. Very, very connected to these things. Very good institution is there. Then we can have a practical training provided to the students, American students. Accommodations are very good. Excellent food is there. And really they enjoy the time. Discussion, Tadvidya, Sambhasha is there. Faculty is wonderful. And we exchange the views and everything for each and every person. That way, it's a mutual exchange of knowledge and everything. Globalization of Ayurveda can happen. We welcoming all the Western audience, Western participants, not only one country, Japanese countries and other countries also. If they are having a language problem, then they can bring some translator for them. Then our faculty can be able to communicate well with the English. And if the Hindi is speaking people are there, then they can be translated into English properly, and then you can communicate it well. The skills can be set properly and educate you, and more thorough examination and thorough the education will be provided to that. And definitely Ayush Ministry and our Prime Minister of India is strongly recommend to globalization of Ayurveda. That is the reason recently we are lucky to have global traditional systems of medicine institute in Jamnagar, Gujarat Ayurveda University established, and that is the traditional medicines are global there already. And, what strongly supporting now globalization is happening. Still long way to go. We are promoting more and more strongly. Thank you one and all, and happy Independence Day all of you on behalf of the our organization.
Thank you, sir. Thank you so much.
Independence Day to you also. Thank you very much.
Thank you. Namaskar.
Dr. Vandana Varalwal ji has joined. No.
Has he joined? No.
So I hope session is open now, sir. Agniotri, sir.
And in the same condition, I hope that we have got two stalwarts also. One Professor Nishant Shukla ji, and the other one is our Gurudev Lakshmikant Dwivedi ji. So both persons very valuable suggestions and informations along in the time of Ashirwad is required. So I welcome first Professor Nishant Shukla ji. If he is comfortable, please come and comment upon both the webinar's topic and the presentations given by our guest speakers. Our great guest speakers, especially in the terms of the Guru Purnima and in the presence of our great gurus. Thank you, sir. Namaskar.
नमस्कार सर, नमस्कार। ये मेरे लिए एक सौभाग्य की बात है कि मेरे गुरुओं की उपस्थिति में मुझे जो है वो गुरु पूर्णिमा के दिन पर जो है वो बोलने का सौभाग्य मिला है। ये एक ऐसा वाक्य है, एक ऐसा जो है ये परिस्थिति है जहाँ गुरु
आपकी आवाज नहीं आ रही है जी सर, आपकी आवाज नहीं आ रही है। कुछ कनेक्टिविटी में दिक्कत हुई है। आपका माइक भी ऑन है, आप जरा कनेक्शन देखिए। आपका तो माइक भी ऑन है, आवाज नहीं आ रही है आपकी।
नमस्कार।
आ गई जी, जी आ रही थोड़ा हाँ, थोड़ा साउंड कम है।
हुआ था
जी, आ गई।
नमन करके करते हुए इस पहले वेबिनार से दूसरे वेबिनार आगे जो है ये काफी सारी अच्छी बातें जो है ये प्रस्तुत की। और स्पोर्ट्स मेडिसिन में एक जो है किस प्रकार से आयुर्वेद का उपयोगिता है, इसको एक्सप्लोर करने की काफी हद तक जरूरत है। एक वाक्य हमारे कॉलेज में हुआ था, एक स्टूडेंट, नर्सिंग का स्टूडेंट हमारी।
प्लीज अनम्यूट योरसेल्फ, आप म्यूट हो गए।
यस सर। और यूएस में आयुर्वेद का वैश्विक फलक पर आयुर्वेद को हमें ले जाने के लिए जिस प्रकार से प्रस्तुतिकरण और जिन जिन बातों को हमें ध्यान रखने के लिए सर ने बताया है, उस चीजों को हम ध्यान रख करके आगे कुछ एक सालों में यह परिस्थिति उत्पन्न करेंगे कि वहां से जो है ये नॉलेज के लिए यहाँ पर इंडिया में लोग आए। थैंक यू वेरी मच सर।
तो उसके तहत हम पा रहे हैं कि ये एक्सचेंज माननीय प्रधानमंत्री जी के लेवल से लेके और एक आयुर्वेदिक प्रैक्टिशनर तक सभी इसको अच्छे से स्वीकार कर रहे हैं और उत्साहित हैं कि जहां से जैसे भी एक्सचेंज के तौर पर जामनगर से लेके और विश्व फलक तक हमारे आयुर्वेद का ज्ञान सुव्यवस्थित तरीके से वैज्ञानिक दृष्टिकोण से अगर आगे बढ़ता है तो हमारे आयुर्वेद का ही नाम होगा, भारत का नाम होगा और जनमानस को आयुर्वेद की सेवाओं को और अच्छे तरीके से समझने और उसका लाभ उठाने का अवसर मिलेगा। मैं आदरणीय प्रोफेसर धन्यवाद प्रोफेसर शुक्ला जी। मैं आदरणीय प्रोफेसर द्विवेदी जी को बड़े आदर के साथ आमंत्रित करता हूं कि आप हमारे आज की तीनों ही वेबिनार्स के लिए कुछ आशीर्वचन देने की कृपा करें। आदरणीय द्विवेदी जी, नमस्कार।
नमस्कार सर, सभी विद्वान वक्ताओं को और जो आज के 3 वेबिनार हुए उसमें जो भागीदार हैं उनको शुभकामनाएं। और मैं पवन जी को एक हार्दिक बधाई इसलिए देना चाहूँगा इस अवसर पे कि हमारे गुरु जी के दर्शन हमको हो गए। काफ़ी दिनों से हरिशंकर शर्मा साहब से मुलाकात नहीं हो पाई थी और अभी कलकत्ता में ही है ये भी पता चला। तो सारी जो स्थिति है उसके लिए मैं बधाई पवन शर्मा जी को दूंगा। और फिर स्पोर्ट्स मेडिसिन की बात है तो ये टर्म बदलती है, बाकी स्थितियां पुरानी ही है। तो पहले सुश्रुत के समय में, युद्ध के काल में सेना के साथ में वैद्य हुआ करते थे, वैसे ही स्पोर्ट्स पर्सन के साथ में जब इस तरह की स्थिति आती है तो वहाँ पर हम उसी स्वरूप में क्षत वगैरह के लिए हम आयुर्वेद का उपयोग करते हैं। और जो अंत में शेखर जी ने बोला, अमेरिका में जो वो अपना पताका लेकर के और आयुर्वेद को विश्व स्तर पे कर रहे हैं, तो यद प्रभा पटलोद्भासी भासते ध्यापि भूतले आयुर्वेदात्मकम ज्योति शाश्वतम न प्रकाशतम। तो आयुर्वेद का जो उद्देश्य है उसके दृष्टिकोण से हमको विश्व में पहले से व्याप्त है, केवल उनको स्मरण करने की जरूरत है। वहाँ उनका नाम अलग हो सकता है, जैसे हम प्राणवायु कहते हैं, रसशास्त्र कहते हैं, वैसे हर एक देश में चिकित्सा पद्धति का नाम अलग होगा, किंतु जो उद्देश्य है वो विश्व स्तर पे एक ही है। इसलिए आज हम उसको केवल एक नए रूप में भारत से प्रसारित करें, ऐसी एक कामना है। और इसलिए मैं भूतल पर आयुर्वेद की प्रभा उद्भासन हो, उसके लिए मैं कामना करता हूँ। धन्यवाद, शुभ रात्रि। थैंक यू सर।
बहुत बहुत आभार सर, आपका बहुत बहुत आभार। आप म्यूट हैं सर, अग्निहोत्री सर आप म्यूट।
बहुत बहुत गुरुदेव, बहुत बहुत आपका आभार। आपने सच्ची कहा, अपने गुरु के दर्शन अगर हो जाए तो इससे बड़ा
वास्तव में पवन जी को इसके लिए मैं धन्यवाद दूंगा वापिस।
बहुत सारी
जय हो जय हो।
ये पवन जी
आप
विभिन्न
सबकी
प्रकार की बधाइयों के पात्र तो हैं ही और इतने ऊंचाई, इतने गहराई और ऊंचाई तक पहुंच गए कि हमारी वेबिनार को हवा में उड़ा के थाईलैंड तक ले गए। आप खुद देखिए, अभी तक तो विदेशी जुड़ते थे हमारे IRES से, वो खुद ही विदेश चले गए। ये देखिए चमत्कार, और हिम्मत नहीं छोड़ी, 1 जुलाई तक तो कर ही ली। मतलब 2-3 तो वेबिनार इन्होंने फॉरेन से ऑर्गेनाइज करी हैं, चाहे वो थाईलैंड से ही, तो ये इनकी कार्यकुशलता है। और इसीलिए चलते चलाते आज अमेरिका दिवस भी मना ही लिया, स्वतंत्रता दिवस,
इन
और
3 सालों में सर 8 कंट्रीज से कर चुका हूँ।
अच्छा अच्छा, अरे
हाँ सर,
बट
किसी को मालूम तक नहीं हुआ कि मैं कहाँ हूँ और क्या हूँ। लेकिन
ये
मैं हर
देखिए आज
जगह
एक
से
और व्यस्तोद्घाटन हो गया द्विवेदी जी। सर देखिए
मलेशिया से किया, श्रीलंका से किया, इसका नेपाल से किया, बांग्लादेश से किया, अब ये थाईलैंड से किया, ऐसे करते ही रह
अरे
रहा हूँ।
भाई साहब पिछले 2.5 साल तो अलाउ ही नहीं थी, परमिशन नहीं थी कोरोना में, कैसे किया? ये सब गड़बड़ है।
अभी 1.5 साल में गया हूँ मलेशिया।
किसमें?
1.5
कोरोना
साल
में?
से 2.5 साल नहीं, अभी
हाँ।
ये 1.5 पौने 2 साल।
अच्छा, इधर मतलब खत्म होने के बाद, लॉकडाउन खत्म होने
हाँ,
के बाद।
इमामी की नौकरी में आखिरी आखिरी।
अच्छा ये भी ठीक है, इमामी को भी श्रेय दे दिया आपने।
देखिए।
ये बात है।
पता
तो
कब
भैया
फहराने वाली बात है।
जो कुछ गंदी दे नहीं तो भी बात सुबास, आपने इमामी को अपनी योग्यताओं का, व्यक्तित्व का भी अच्छे से आगाह करा दिया। चलिए साहब शुरुआती करिए, सब लोग।
शुभ रात्रि,
माया
नमस्कार।
जी, माया जी अपने साथ जुड़ी हुई हैं।
हाँ 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 हाँ,
माया जी कुछ बोलना
कुछ
चाहें
देना
तो
चाहेंगे
शुरू
कुछ?
से जुड़ी है आदरणीय माया जी। We would like to invite Maya ji for her valuable comments. I hope she is not comfortable. So good night, मैडम पारुल जी, बहुत बहुत धन्यवाद, बहुत बहुत आभार आपका, बहुत बहुत आभार। थैंक यू वेरी मच।
आपका भी आभार सर जी। शुभ रात्रि।
शुभ रात्रि, नमस्कार।